Clinton Gore campaign advisor, and Mark Thiessen, who is a former speechwriter for President George W. Bush. Gentlemen, good to talk to both of you. Richard,
hi, Rick.
The polls show that support for the Democrats' health reform plan is low, and it's sinking every single day. Now, that means that a lot of people who supported President Obama, while he was running for office, are now not supporting him on this, and he ran on health care reform. What's going on?
Well, you know, if you look at the polls, they actually go in both directions. If people are asked, without health care reform, do you think your costs will go up? They answer yes. Do you think you'll have less access to your current doctors? Yes. Do you think you'll have more problems with your insurance company? Yes. And, as you point out, they now have fears about this health care doing exactly the same thing. So they're just generally scared. I think the people that we're seeing at these town halls who are raising a ruckus are raising ruckus not so much about health care, but generally a feeling of powerlessness. For the most part, these are, I think, Republicans who their party lost. The economy's not great. There's a feeling that the American dream is kind of slipping away, which is why you hear people talking about, you know, the country falling apart piece by piece, or you know, don't mess with the Constitution. Those aren't concerns about health care. And I just think what you're seeing is just a general sense of people feeling a sense of unrest.
Let me get to Mark.
It's hard. Yeah, sure.
Mark, you're a former speechwriter. You know how hard it is for a White House to craft a message and to sell a message. What is the problem for President Obama as you look at it from the other side of the political spectrum? Sure. Is it his speeches or is it the policy?
I think it's the policy. It's the substance. A good speech can't sell a bad plan. The reality is the more people learn about this plan, the less they like it. The polls have gone down something like 9% in the last few weeks. And people there's a majority of the country that's now opposed to what Obama wants to do, and they're not just opposed to it, they are angry about it. You're seeing this in the town hall meetings. People think that what he's proposing is essentially socialism. It's un-American, and they think it's not going to change the character of our healthcare system. They think it's going to change the character of our country, and they're upset about it. And so they're speaking out, and I think what you're seeing is a popular uprising against a big government plan to take over one of the largest sectors of our economy and essentially socialize it, and it's dangerous.
And yet yesterday, Richard, when the president spoke in Portsmouth, and we've got some video on the right side of the screen of that, he talked about fear-mongering by the other side. He talked about lies that were being spread by the other side. Did the president help his cause yesterday? Did he silence any of his critics? Did he change any minds?
Well, look, you know, the Republicans, and Sarah Palin in particular, did the president a big favor by talking about these death panels. I mean, talk about something that's not only ridiculous and absurd on its face, but it kind of harkens back to the kind of suggestions of intolerance that I think the public saw during the campaign that turned them off to Sarah Palin and her ticket. So in that regard, frankly, I think the president's opponents are doing him a favor, and I think he helps himself almost every time that he gets up, because he speaks in a pretty matter-of-fact but fairly compelling and informed way to people using everyday language. This website that the White House has put up to try to rebut these things, I think helps not so much the people going to the town halls, their minds are made up, but I think people who are on the fence or the press have a place to check and see whether these things ring true or not.
Mark, is there fear-mongering going on when we hear talk about death panels, we hear talk about forced abortions or insurance for illegal aliens? Do you think that people are getting the kind of accurate information that they need to know in order to make up their minds about all
I think
this?
They're getting, the more they know about this, the less they like this plan. Look, the fact of the matter is that this plan is designed to get savings out of Medicare in order to fund health care for a national health care plan. How do you get savings out of Medicare? You deny coverage. You push elderly people into hospice instead of life-extending treatments. You deny them. You create a panel, the Center for Health Outcomes is what the people are referring to in the bill, which is empowered to ration care in order to get savings out of Medicare. And the people whose care is going to be rationed are elderly people who want expensive life-extending treatment, and they want to push them into hospice. So these are real concerns, and this is the problem: is when you get government in charge of health care instead of doctors and patients, then government bureaucrats make careless decisions, and people are worried about putting government bureaucrats in charge of their health care instead of patients and doctors.
Richard, last question for you. Yesterday, the president talked about the U.S. Postal Service and the way that UPS and FedEx have been able to do pretty well competing with with the Postal Service to try to support the idea of the public option. But a lot of people today are saying that was a terrible idea to make a comparison with a government agency that is bankrupt and having to cut services.
No.
How does the White House, is it even possible for the president at this point to get the momentum back in his favor when it comes to health care reform?
Well, his whole point in the comparison to the Postal Service was to say, don't be afraid of a government entity. They haven't forced out the private sector in the delivery field. There's no reason to think that's going to happen in health care. You know, it's amazing when some of these town halls where people say, don't let the government get its hands on my Medicare. What an absurd notion. Medicare is a government program which people like and is frankly much more efficient. The overhead is much, much less than private insurance plans. So I think this is kind of be something that the president really needs to kind of dial it back a little bit, but also get out there and explain to people, because I think when he does, I think he's pretty compelling, and I think the polls will show that, you know, when we see it a few weeks from now.
They're scheduling a couple of more of these town